Hello everyone, I'm Ekin Eray. Today I will briefly present you our research project on visualizing indicators of project health. Here you see the outline for this presentation. I will start with a brief introduction to topic, then I will explain our objectives. After that, I will walk you through the methodology we developed, and I will finish with presenting the validation of this research with case projects. In this research, our main goal was measuring health and workload of the interactions between project stakeholders in complex construction projects such as mass rapid transit systems and nuclear power plant projects. Typically, complex construction projects involve large number of stakeholders with different backgrounds and separate locations. They involve multiple contract types, and they have high cost as well as exposure to risk. In addition to all this, these projects also have a dynamic environment throughout their life cycle where the number of project stakeholders and the connections between them changes in project phase. In such dynamic environment, project health directly affected by these stakeholder connections. Briefly, health condition of a project can be determined by checking whether this project is performing according to its goals, objectives, and by the interactions between project stakeholders. Especially in the early phases of complex capital projects, communication and collaboration between project stakeholders have a huge impact on the overall success of the project. Any interface health problems, such as any misalignment or miscommunication between project stakeholders on interfaces, on requests and responses, on deliverables, or on the revisions of the documents, can directly affect project success. Therefore, it is important to detect any unhealthy and overloaded connections between project stakeholders before overall project health condition get affected. In this research, our main objectives are measuring interface health between project stakeholders, estimating workload between project stakeholders, and estimating workload of the stakeholders by conducting social network analysis. This research has connections with previous CII research projects such as leading indicators to project outcome and interface management. And it is expected that this research will open doors to new CII research projects on project health measurement by data mining and AI, and portfolio health measurement. Before going into details on the methodology, I want to quickly mention what is in it for you on this research or how it will be helpful for you. This will be a new proof of concept of a simple tool that will help you to visualize project stakeholders and their connections throughout project lifecycle. It will help you to measure workload of project stakeholders, between stakeholders, and to measure health condition between project stakeholders. So you will see any unhealthy and overloaded stakeholder connection that can affect overall project health. In other words, this research has the potential to give owners and managers an early indication about where additional effort might be best applied to support project success. Now I will briefly walk you through the steps of the integrated project monitoring method which we developed as part of this research project. Typically, construction organizations undertake several projects simultaneously. Therefore, the first step is selecting the project that will be assessed. Then, master stakeholder list that shows all project stakeholders involved in the project should be created. While defining this list, timeline of each stakeholder should be indicated. Then, the connections between project stakeholders for each project phase should be defined. At the end of this step, interface networks, as you can see here, for each project phase can be created. In these networks, nodes are representing stakeholders, and links are representing connections between them. After creating these networks, next step is evaluation of stakeholder connections. For this step, we developed two frameworks. First one, named Framework A, is a quantitative method, and it uses project data to measure interface health between project stakeholders. This framework consists of 14 quantitative health indicators, and these indicators can be calculated by using project data retrieved from electronic project information management systems, such as Request for Information System, Change Management System, Interface Management System, Project Schedule, and Document Management System. This framework can provide objective and continuous interface health results. However, it is hard to implement it in practice. We had several meetings with industry partners, and we found that it is hard to get required data because it was either companies were not using all the mentioned systems, or it was hard to reach the data on their database. Therefore, we developed Framework B, which focuses on measuring both workload and health between project stakeholders by using a simple, novel qualitative point system. Here you see the point system used for workload measurement between project stakeholders. There are 4 main criteria, which are interfaces, communication frequency, agreements, and deliverables. We use a 3-point scale in this system, where 3 means high workload and 1 means low workload. And this is the point system used for health measurement between project stakeholders, and it is similar with the previous one. There are again 4 main criteria, which are responsiveness, punctuality, alignment, and revisions. And again, we use a 3-point scale where 3 indicates a poor health condition and 1 indicates a healthier relationship. So in order to measure interface health and workload between project stakeholders, each stakeholder connection needs to be evaluated by using this point system. After the evaluation, health results are presented with the color codes on the links, and the workload is represented with the thickness of the links. Moreover, when the Framework B is used, the workload on the stakeholders can be obtained by conducting social network analysis. In this framework, we use degree centrality as part of the analysis, and results are represented as the node size. In the past 4 years, we conducted research meetings with 6 different organizations. Among these 6, 3 of them were or still are CII members. And in order to validate the integrated project monitoring method, we conducted 37 research meetings with 2 industry partners. One of them is a current CII member. 15 of these meetings were with the industry partner in the railway industry, and 22 of them were with the industry partner in the nuclear power industry. In these meetings, we explained our objectives of this research project, we selected example projects from their portfolio, then we collected data, conducted the analysis, and we shared our results and got feedback at the end. Since we have a limited time now, I will only present you 2 projects, one from each industry. The first example project was a design-build type industrial rail line project located in North America. The estimated construction cost of the project was $110 million, and anticipated duration of the design phase was 19 months. After we selected this project, our industry partner provided stakeholder list and stakeholder connection list for the design phase of this project. When we collected data for this project, the project was in design phase. Therefore, we only did our analysis for the design phase for this project. Also, I should mention that our industry partner here was the consultant team of the rail line project. After obtaining stakeholder connection data, we explained the point system to the project manager and asked him to evaluate each stakeholder connection by using this point system. Here you see the collected data for the design phase of this project. Then, using this data, we calculated the workload and health value of each stakeholder connection and degree centrality value of each node. And here you see the results on the stakeholder interface network. For this visualization, I use an open source program called Gephi. Based on the analysis, we found the highest workload was between contractors project management team and contractor surveyors team. And the poorest health condition was between owner's project management team and contractor's project management team. On the other hand, the lowest workload and the healthiest connections were found between consultants project management team and 2 regulatory offices. After obtaining these results, we did a review meeting with the project manager, and in that meeting, we discussed if these results are presenting the actual project condition or not. During this meeting, we learned that there were problems on this project related with land acquisition, budget, and interactions with the owner. And those problems were creating health issues between project owner and the contractor. Additionally, we learned that consultant team was working on submission to those regulatory offices, and meetings between them were in a friendly environment. And since consultant hadn't submitted documents yet, the workload between those stakeholders were not high. On the other hand, the project manager stated that these connections should be evaluated once more when they submit the documents, because then the workload and health condition of these connections might change. So overall, these results were found very accurate by the project manager of this project. Also, with these simple steps and tools, project manager found it reasonable to take these snapshots of this project bi-weekly. After 1.5 months, we analyzed the same project again. However, this time we asked more detailed stakeholder list and more detailed stakeholder connection list. So this time we had 19 stakeholders and 64 stakeholder connections. We follow similar steps to create stakeholder interface network, and the project manager evaluated each stakeholder connection again. This time, poorest health condition was between owner and consultant's drainage team and consultant's environments team. After obtaining these results, we did a face-to-face meeting with the rail lead of this company, and in that meeting, we shared these results with him. And we learned that there was a river on the route of this rail line project, and the consultant had been designing a bridge for this rail line. However, there were problems with the drainage design and the environmental permits for that bridge. That was the reason why the collaboration between owner and the consultant's design team was in a poor state. Thus, at the end of this review meeting, these results were also found accurate by the rail lead of this company. We also applied this method to 5 active nuclear power plant refurbishment projects. All of these projects had a dynamic project environment where a number of stakeholders and stakeholders' connections changed throughout the project lifecycle. Therefore, they had dynamic networks. In addition to that, some of these projects were sharing same space and same stakeholders, which were creating extra complexity to the project managers. During the initial meetings with the project's control team, we learned that refurbishment projects in this power plant were following 7 project phases, which are identification, initiation, development, definition, execution, closeout, and PIR. Among these 5 projects, I will present you only one of them in detail. This is a detector assemblies replacement project. You see on the left side the dynamic stakeholder interface network, which changed and evolved throughout the project lifecycle. Briefly, the project scope was replacing the detector assemblies and power supplies with new equipments in 4 reactors in the power plant. The anticipated project duration, including the applications in all reactors, was approximately 10 years. The data collection step was similar as the rail line project. Only difference were we collected data for 4 phases for this project. After analyzing the data, we found that the highest workload value was between design team and vendor team in execution phase. And the poorest health condition throughout project lifecycle was between projects team and outage team in the definition phase. Later, we had a review meeting with the project manager and shared these results and asked open-ended questions to reveal the root causes of the poor health conditions between project stakeholders. We learned that this project started late at the beginning and they missed all milestones along the way. Besides, internal stakeholders, which are represented with green color here, were undertaking various other projects and they had their own internal milestones which have a higher priority for the nuclear power plant. This was the main reason why projects group and the outage group had the poorest health condition in the definition phase. Since all milestones missed during the project before outage group was active, the project was late, and when definition phase started, outage group had internal milestones that had higher priority that affects the overall plant. That created poor health conditions between projects group and outage group. So in short, the analysis results were found to correspond with the actual project conditions, and they were validated by the project manager of this project. Before moving to the conclusion, I want to show you a bigger picture here. These are the dynamic stakeholder interface networks of the projects we analyzed in that nuclear power plant. All of these projects are replacement projects of different items or systems in the same nuclear power plant. As you can see, networks of each project are unique. Some networks are tightly connected, where there are a high number of stakeholder connections between project stakeholders, while some of them are more loosely connected. Also, the workload and health analysis results vary for each project. For example, this is the control positioner replacement project. In this project, we collected workload data for all project phases, but health data was available only for the first 4 phases. Thus, the color of the links in the last 3 phases are gray. In this project, poorest health condition was found between design team and computers group during the definition phase. And in the review meeting, we questioned that connection and learned that rework between these groups was high during the definition phase because there were inconsistencies in the reports, and that was creating poor health condition among these project stakeholders. Another example is the AGU replacement project. In this project, the poorest health condition throughout the project lifecycle was found between operations group and control maintenance group in the execution phase. Later, we shared these results with the project manager of this project, and we learned that internal priorities was affecting health conditions between project stakeholders. For example, the reason behind the relatively poor health condition between control maintenance and operations was the misalignment of the stakeholder priorities. These stakeholders had other ongoing projects that had higher priorities for the nuclear power plant, and that was affecting the health of this connection. We had some limitations in this research project, and they are topics for future work. For example, we had only one decision maker in each project. However, in order to consider different perspectives of the project stakeholders, these evaluations should be done by multiple stakeholders and even multiple people in the same team. For example, can you spot the difference here? So even though these two networks look similar, different perspectives on the health conditions are represented. Also in this research, we take all criteria weights equal to each other. It is recommended to investigate the impact of the criteria weights on the health and workload analysis. Moreover, expanding the integrated project monitoring method to portfolio level research is a promising research area. This way, impact of a new project in a portfolio of projects can be assessed too. Here is our project team. Professor Haas and Professor Rayside are the co-PIs of this project. I worked on this project as a PhD student. Thank you.
Great job, that sounded really good.